All right, we're recording. Welcome, everyone. Um, so I'm Katie Kerr. I know I have not met all of you, but uh, I thought tonight what we could do is just start off with some introductions, maybe share, where you're from, what you're up to, what you're doing right now, and um, maybe share a career goal you have, or what you're looking forward to do after graduation, because it'll be here before you know it, uh, after
Yeah.
summer. So, all right. Well, actually, hold on. Sorry. We should start with David and Laura. I I mean, do you know everybody or
Yeah, let's do that. So, David Mark, I am the chair of the Department of Health Informatics and Information Management. I am up, so I live in Hermantown, Minnesota, which is, just outside of Duluth. So I'm on campus basically every day. Yeah, I will be working closely with all of you as you're going through this last step, the through the capstone phase of your graduate studies. Laura?
Evening, you have to bear with me. I'm dealing with a bug. Anyway, I know all of you, which is great to have you join tonight. But I also want to say that this is a learning process for me too, because this is different than the other capstones that I have worked with in the past. So together we'll learn, and I hope to gain knowledge that can help you and provide resources and support that you need. So I look forward to learning and growing with you this evening as well.
thanks for being here, Laura. All right. Do you guys mind if I'll just call on people? Maybe Rob, do you want to start? You're the first one on my screen here.
Sure, happy to. Um, so I currently work with Essentia Health. I'm operations manager for the International Falls and Ely clinics. Been doing that for 4.5 years or so. I do live in International Falls, way up here on the border. And I guess I don't have a specific plan for after graduation, but certainly want to progress in my career,
Mhm.
um, whether with Essentia or elsewhere. Yeah,
Great.
guess that.
Thank you. Anna.
Yeah, I'm Anna Wakefield. I live in Bemidji. I work for Sanford Health, and I recently took a new role as the director of inpatient nursing for women's and children's here. So,
Congratulations.
thank you. I am learning a new role now. So after graduation, I expect more learning, but I'm really looking forward to not planning my weekends around homework.
I think everyone looks forward to that.
Yeah.
Great. All right. Erin.
Yeah, hi. I'm actually at the Mall of America right now with my family, so I'll probably
Oh,
jump back on and off from my video here. But I currently am a physician assistant at St. Clair Hospital. I work in general surgery, and then I one day a week I actually work as a provider informaticist with our clinical informatics team. And so after graduation, I am hoping to kind of expand that role a little bit. My goal would be to probably get into informatics full time if I'm able to do that. Within Central Care would be great, but we'll see kind of what happens from there.
Aaron,
Wonderful.
you and I should talk.
Yeah, absolutely. Whatever advice or information you have for
Yeah,
me, I am open ears.
that's my wheelhouse is the informatics space. So I'd be happy to connect you with some folks.
Great, thank you.
Deal. Thanks, Erin. Jesse.
Sorry, I'm in the car in between drop off to activities, but I'm Jessie
Yeah.
Christopherson. I currently work at Essentia Health as a program manager for Pathway to Excellence, and I'm not exactly sure where my career will take me, hoping to move into a director position sooner than later, but otherwise open to opportunities.
Great.
Great.
And is it Hallie?
Yes, it's Hallie.
Sorry. Thank you.
That's okay.
I totally said Haley. Sorry. I bet you'd never get that. I bet you'd never get that.
No, I don't think I've ever had anyone say it right the first time. So,
Yeah.
I'm Hallie Pitsley, and I'm the lab director for Hayward Medical Center through Tamarack Health. And we're so busy with growth right now that after graduation, I think I just want to focus on surviving. The Tamarack Health System is currently working on moving into Spooner. And so we've taken over Ashland, we're up into Hurley, we're gonna go to Spooner and so yeah, it's a lot of learning and this program has really helped me out with all the growth that we're having.
Hallie, did
Yeah.
you grow up in that area?
I grew up in Superior, but pretty much lived
Okay.
my life in Iron River with my
Yeah.
grandparents. So yeah.
I grew up in Chautauqua, Wisconsin, so I spent a lot of time there.
Nice. Thank you. Thank you all. I haven't seen anybody else join, so I think we'll dive into the slide deck David and I have here. I'll share my screen. All right, can you all see that? Okay.
Yeah.
Yeah.
Okay, great. So, so tonight we're just gonna, start off with kind of a high level overview of the capstone presentation, and then we'll dive a little bit deeper. I know David wants to get into some specifics and provide some guidance for all of you on some ideas on where you might want to take your capstone project. And then at the end, I'll talk a little bit about I think everybody in your cohort but one person took the little survey about how you'd like to handle your capstone, whether virtual or in person. So I'll share the results from that. And then, of course, we'll open it up for any questions that you all might have. So, all right. I don't know, David, do you want to start off or do
Yeah.
you want me to?
Yeah, I can
Okay.
I can I can take this. Um one thing I want to note regarding the capstone, we last semester learned a lot about what worked, what, could have done better as well. And one thing that came to our attention very quickly is that to do a full-fledged project where more from like a traditional thesis perspective, there's just to do that well in a 16-week format is just entirely not feasible. So what we've done is we've worked closely with our MBA programs as well. So Dave Swenson, who was involved at the Capstone, co-taught the Capstone course this last semester, working closely with him along with Bob Hartle, who's the former program director for the MBA in leadership and change. We've worked closely with them to get an idea of like how, like from learning from what worked in that context, and how we can adapt that. Because what they've done for the last many years is approached a capstone project where in a 16-week, and in the summer it's actually slightly shorter than that, format, be able to go through in this ideation phase where developing a really, really solid project, but that project is more from the perspective of creating an evaluative method on a topic that's important to you, with the understanding that that evaluative method is something you would execute not during those 16 weeks, but developing a project that you can take with you at the conclusion of your capstone that you can implement after the fact. So, working with your faculty and our industry partners that we want to bring in on this as well, to be able to get the feedback and the guidance so that you can investigate the background of a topic that's important, that's meaningful, that really embeds a lot of what you've learned up to this point into a project that you can implement once you're done with your graduate program. So the capstone, the completed capstone, the outline for that capstone in terms of like what that penultimate capstone project would look like is listed on the screen here. We do have a couple links to artifacts that will give you more information, but in these subsequent slides, I'll explain this in more detail. We'll share this with you too, that Katie, maybe when we
Mhm.
share the recording, we'll share
Definitely.
these slides too, so that you can click on those links and see what those actual artifacts are, because there's a lot of detail that
Yeah.
we put into being able to do this in a more complete fashion. So the purpose of the capstone is for you to demonstrate mastery of the program. That includes the concepts, the practices that you've learned around healthcare administration. So also, the intended purpose of the capstone is for you to build expertise in a very specific area that's meaningful to you, and considering, this could be a foundational um, component for setting you into that next phase of your career when you graduate. It's also an opportunity to network professionally amongst your colleagues here, as within the your cohort, but also the idea is to bring in other industry partners to be able to support your work and provide you with feedback, guidance, mentorship throughout. And then also, once you're done, is engaging with your professional network in terms of how you intend to implement the work that you have worked on. It's also intended to increase visibility and the responsibility of your work, so that it's not living in a silo, that you're engaging with people and partners, and in the intended final product being something that you actually could feasibly implement. It's not just a pipe dream. And then also return your skills back to maybe your organization you're working in right now. So, for instance, maybe Rob, it's a project that you're really been wanting to prioritize within your work, and now this is an opportunity to actually build upon that in something you could feasibly implement in your current role, or maybe build a pathway for you to move into a future role. And then also to indulge that special interest of yours. So maybe it's that something that really is you're passionate about. So here's some examples. Oh, I'm sorry, I'm
No.
not there yet.
Yeah.
So this
Differences.
isn't this is an applied project. What that means is a traditional thesis is very it's very research based. The applied project is more of a conceptually developed project based off of um, things in the industry that actually could be feasible and you can implement. So with a thesis, you tend to have, empirically based project, which is again a research based. It's based off of a research question, and you're intending to answer that specific research question. With applied project, there's purpose behind it. It's based off your own personal experiences or your own understanding of the healthcare arena. There's deliverables and outcomes that are embedded within the work that you're doing, so that it's something that can actually be implemented, versus a research question that you are collecting data using an instrumentation, or applying a statistical inferential method, or versus in an applied project, you're really diving into what has been done in the past, looking at literature, peer-reviewed literature, talking to colleagues, looking at professional networks, and the work that's happening. Maybe it's a understanding of what's been done historically within your organization, in talking to leadership and colleagues around what are the gaps, issues, the history, and the foundation for a eventual solution to that problem that you're hoping to solve. A thesis requires IRB approval. With an applied project, what you're doing is you're proposing a solution. So you're investigating a problem, and you're going to propose a solution, but you won't necessarily be actually executing on that solution at this point. So it does not require an IRB approval. That was one thing that we ran into
Yeah.
significant challenges with last semester. We had significant delays with some of the students' projects because it was all an empirically based, like traditional thesis project that went from conception to a proposal to a needing IRB approval, then having to conduct that research and then having to formulate that research into a a thesis uh, like a final thesis with multiple chapters and then the presentation. We ran out of time in that's those 16 weeks that we spent on that project. Here, the idea is to spend the time investigating your problem and then going through those steps of developing and proposing a solution. And then this applied project, it's really diving into that discussion section about how do you intend, what is your plan for implementing the proposal, managing the barriers of to implement that solution. Including things like the human resistance to change, metrics, investigating metrics for how you're going to evaluate the outcomes of that proposed solution, you're making recommendations for gap based off of the gaps for future work that can be done. Okay, let's move on to the next one.
Okay.
So some project considerations, questions to ask. Is this project interesting to you? That's the first thing. Do something that's of interest to you. Will it be valuable to you now? Hopefully, yes. But also, what more and more importantly, is this something that's valuable to you in the future? Will it be valuable in the next 3 months? In the next 6 months? Is it something that the true value doesn't show up maybe a year from now? What needs to happen to ensure that this is something that's valuable for you? So focus on something that has more immediate return than something that is that pipe dream. Like you really wouldn't have the resources to implement on if, within the next like year. Can you clearly define the problem and the proposed solution? Is it something you feasibly could do given your current role, your current positionality within your organization, or maybe even with you as a patient? You could take it from that perspective as well. Can it be researched and written within the time frame that we have? So you have just under 16 weeks in the summer term to do it. So that's going to be something that you work very closely with faculty, with Katie and I, and your with our industry partners, is making sure this is something that is feasible to do within that time frame. And is there sufficient available authoritative literature to provide a foundation for your project? We're not looking for a 150-page dissertation. Within a 30 to 35 pages, being able to develop a sound proposal of a project that is an applied project that is that major takeaway from the capstone. And do you have the time and support to actually commit to this option? Not just the capstone, but also the project to ensure that it's something that upon the finality of your project, if we checked in on you in 6 months, you're like, yeah, I was able to develop something that 6 months after graduation, here's what was a result of this project. That is what we want. We want something that you can take away and run with. So some project considerations. Now remember that the capstone is intended to demonstrate what you've learned about the concepts, the practices around healthcare leadership in the program, and how this can be applied to real healthcare issues. It's evidence-based. It's not just an editorial opinion. So you can't just be like, I know this is going to work because I just know, right? It has to be backed up by evidence. That by diving into peer-reviewed literature, by looking at best practices, frameworks, that can allow not just be your spoken word, but your spoken word backed up by those those theoretical frameworks. Also, if you feel too strongly about a topic, sometimes you may have trouble limiting it, cutting back parts of it, seeing the important features that you may not agree with. So sometimes if there's a topic that you're working on that you almost live a little too closely with or is embedded in your everyday work, it's oftentimes difficult to see a potential solution that is maybe from a different perspective, right? So, or being able to pull in pieces of evidence that isn't more of a basically a confirmation bias of how you um, uh, that is basically infringed based upon your prior experiences and only your prior experiences. So really leaning in further into not just what what building a project based off of what you see as an important problem right now. It's something that has that strong evidence-based literature, that it's research that you can rely on and go through peer-reviewed literature and be able to support your convictions and opinions. Okay, so what's your role? Your role, I'm sorry, our
Our
role. Our
role.
role is we're in the instructors, program director, chair of the department. We are a collaborator. We are also the naive expert role. So you are the expert. And your role is to, if we're having a hard time understanding exactly what the intended project is supposed to solve, what the problem is, or what the solution is that you're proposing, that could be a problem in terms of being able to actually implement what the proposal is you're putting together. We are also going to help you in revisions, crafting revisions. This is going to be a dynamic document in that you'll be working very closely with us and very individually as well. So we're going to meet together as a group, and then we're going to set you off on your own, and then there's going to be opportunity to meet one-on-one as well. Also networking with other students, faculty, and it may not just be us, other faculty you've had in the past. Maybe there's faculty that we know have expertise in the particular topic that you're really interested in. We would connect you with them. Authors, researchers, industry experts, professionals that we might know have potential experience in the topic that you are interested in working on. We also serve as a second reader, someone that is going to be looking at you're going to be so ingrained in this document that you're putting together that sometimes it's difficult to see the forest through the trees. So being able to have us intermittently going in there, providing you with feedback, support, asking you questions, that is how you get to that final product it's going to be a very collaborative process. So the way this will start is you start with a proposal. Okay, this is basically going to be done within the first couple weeks of your of the capstone class. And in that proposal, you're going to start with just very limited information in these different categories. Okay, so you're going to do very rapid research. You should already come into that capstone with an idea of a problem that you want to propose a solution for. Okay, so start thinking about that now. If you haven't thought about it, now's the time. How do you get to that? Talk to people. Reflect on your own personal experiences, things that are even challenges you're seeing within your own organization, that there's opportunity for a challenge for change. That is a good topic to focus in on. But this initial proposal is going to be a very brief, where you have a title, you have an introductory chapter where you're providing a problem statement, overview of potential deliverables or outcomes for the project. and then very brief background on the problem. That may be also embedded in that'll lead into your literature review, like in terms of that background about like why is it something that's important to you? Why is this something you want to focus on? The literature review will be an outline of your argument, you know, looking at what research has been done or what frameworks have been developed, what theories are out there that will allow you to support that problem statement. So it's the basis of or it could even be evidence that's already been put together regarding a solution or related solution that is potentially close to your problem statement. Chapter 3, this is a solution. Now, this is going to be more limited in the proposal, but have an idea about how you could potentially solve that problem statement. You can state, what a change approach, like from a change management perspective, maybe model a model you want to deploy or an intervention that you would want to implement as a potential solution. Avoid just a collection of techniques, though, of like, I'm going to just ask people their opinions and that's my solution, right? No, how would you solve the problem statement that you are introducing in that first chapter? And then, but at the proposal phase, this is going to be very, very brief. You're going to dive much deeper into that. This is going to be the stage that's really, really refined more and more and more and more. And then the discussion, this is a section, it's going to be very premature at the time of your proposal. So unless you have a opportunity to discuss how your solution could potentially solve that problem, some of you won't even have a discussion yet at the time of the proposal. Some of you might want to be working on a project that you've already started in terms of like that planning phase, but you haven't gotten around to actually figuring out a solution yet. So, or investigating whether your solution has any merit. And then you'll have some references that'll tie back to your literature review, where you're going to be citing journals or high authority sources to show the availability of literature and your familiarity with it. And we do ask that you're going to use APA format for your citations as well. The final project, so once you do that proposal, what'll happen is you'll have several reviewers. So you're going to have your instructor review it. Katie and I will be reviewing it. And then you're also going to have an industry partner that we're going to bring in and try to assign for each of you, depending on what that project, is, and to also review. And then you're going to get some feedback. And this begins the real work, where that feedback is going to set you up so that you can continue to refine that proposal into a final project structure. So that final project structure is going to be a final paper that is going to be structured as an expansion of that proposal. So you're going to dive further into that introduction of how you describe the problem. Maybe there's questions that we have about why is this a problem? What specifically is about the problem that's unique to your circumstances? This is a problem that can be generalized to potentially other organizations. Expanding on the literature review, expanding on that solution. That's going to be the area that you probably have the greatest refinement and revisions on is with that stated problem, how can you solve that problem? What we'd like you to do is show some sort of graphic, a conceptual model, an explanation, a way for you to track how your solution is going to actually lead to change to be able to solve that problem. And then in that discussion section that'll be included in the final paper, you discuss how you intend to implement your solution, the barriers that you will investigate as part of the solution, a suggestion for evaluating that implementation. What are your, KPIs, your key performance indicators about how that solution is actually leading to success or maybe potential failure? What are those indicators? identifying future research and then the conclusions about concluding from reintroducing that problem and then talking just very briefly about how your solution has will likely lead to a resolution of whatever that problem statement is. So here's some example topics. This could be something like investigating, a best organization development and training methods for a nonprofit healthcare organization through implementing a new software systems. So this is more of an informatics angled type of project. You might look at value-based purchasing in healthcare in dialogic organizational development. So that is more of a managerial project that you could potentially implement a new organizational development framework that could support a larger base plan around value-based purchasing. Could be a project related to organizational development initiatives that best position a private primary care clinic in a rural community. So what initiatives would need to be in place if you were to want to implement a new clinic in a particular area? Why is it feasible to implement that clinic in that area? What would be the potential solution? I actually worked on a project like that just recently, and it was very, very interesting. You could propose a succession planning and leadership development program for a critical access hospital. Use cultural dialogue to improve nursing retention in an inpatient setting. You could align behavioral employee behavior with an organization's core values through inquiry and storytelling, which could be a way of building, morale within an organization as well. So these are just some examples. So here are some links to documents that, again, they're linked in that first, second, third slide, whatever.
Yes. Yep.
We encourage you to review to get a better understanding, more details around the capstone proposal and project outline, and then also the capstone overview and the more detailed instructions. So there's the higher level and then the details that are included in those documents. So, Katie, I'll
Yeah.
hand it off to you.
I think before I go on to the next topic, David, I just want to open it up after David's kind of, he talked fast and he shared a lot of information with you. So, do you have any questions just initially, like as we've gone through this, about the capstone? Concerns? Maybe that's. I know I've met with, I think, 3 of you, and I think the topics you had already kind of discussed with me would be good fit for what we're proposing here and what we plan to do. So, I
Rob,
know.
did you have a comment or question? I see you unmuted.
Oh, there we go. Sorry.
Well, yeah, I was waiting for Katie to finish.
Sorry.
I think I still struggle with scoping of this, right? I mean, how broad of a topic, and then how specific is the plan for implementation? And within that, I mean, so I work at Essentia. Do I want to focus on trying to implement something there, or is this supposed to be for healthcare industry in general, on more general terms?
I think this is what you want it to be, Rob. So if you have intention of staying within your role, at least for a period of time, what I would encourage you to do is think about a problem you're experiencing now within your organization and propose a something again that interests you on something that you could implement in your current role. If that is not your, professional goals, like your career goals, and you're thinking more broad based, it certainly could be outside of the organization in which you're working in. So that really that's up to you. And Rob, sometimes I think this is where just having a brainstorming session, like if you wanted to just chat and just have a brainstorming session, and just by us asking you questions, sometimes we can get there, about what are your greatest pains? What are your greatest challenges that you're currently experiencing? oftentimes something that you're experiencing, in your current role will likely be challenges that you would face in a different organization as well, too. So I think that it could hit both of what you're describing too. Something that you applies to your current role certainly could apply to a new role as well.
Sure, and I appreciate that. I guess specifically with the paper we're going to be writing, though, I mean, is that intended to be, a playbook for me, or is that intended to be something someone else might be able to use to help
Mm.
themselves in their new
Oh,
job?
that's a
Mm,
great,
good
great
question.
question, Rob. I think that it could be both. So it could certainly be a playbook for you, but if you were to hand it off to, let's say, a one of your colleagues, that it's something that they would have a clear plan of implementing a solution for a problem that you're experiencing. So absolutely, I think it could be by reading your final paper, that could be a playbook for anyone that picks up that document. So there might be someone in that is experiencing a similar problem that could view your solution that you're developing as applicable to their own experiences too.
And David, what is the database that these get published in? Can never remember if it's ProQuest or
Yep, that's it.
yeah,
ProQuest.
ProQuest. So the thought too is that this would get published in ProQuest, and so it would be available to, anybody that has access to ProQuest. So um, it's kind of a nice thing too. Like it's something that if it is something that can apply to another organization or another leader, that they can learn from you as well and reuse and implement.
You know, I think that a lot of the projects are very specific. Like what you look back on some of what the MBA students have done in the past, they're very, very specific to their role and organization. But there is uh, that can be generalized to other organizations, or maybe it's not in like, surgical nursing role, the nursing leadership role. It could be in a different nursing leadership role, like so there's an ability to generalize that approach, your project potentially to other settings.
The
But
other
it
thing,
doesn't have to be in your explicit paper. Could be very, ideally very detailed to the problem that you're trying to solve.
the only other thing I wanted to mention quickly, and I apologize, I cannot remember which document it is, if it's the proposal and project outline or if it's actual instructions, but I did share two example MBA in rural leader. Is it rural leadership? Yeah.
MBA
Uh,
in health leadership and change. Yep.
okay. And so I provided two examples that students are have offered to share with other students, but just to give you an idea, so you can look at what two other students have done to give maybe get you thinking along the right lines
Hmm.
and scoping. So
Thanks.
yep.
I think I may have missed this. Are you guys sharing the documents or you'll be sharing the slides?
Yes.
Okay.
So Anna, there'll be the slides, but if it's easiest to also share the links because they're all in Google Drive, so we can just
Yeah,
share the
that
links.
the
But
slides is perfect.
Okay.
okay,
I feel like I missed maybe that part.
Yeah.
no, that's totally fine. We've got links in the slides, but
Yeah.
we can also just through the recording of this, just share the
Yeah.
links in the email too.
Yeah. Easy enough.
Yeah.
Any other?
We'll give you view access though, so you don't change anything inadvertently. All right.
Any other questions before we move on?
If at any point, here's what I'll say about this. If at any point you just want to have a conversation, and Katie's been doing a lot of these already, um, let's do it. Let's talk about it.
Mhm.
Okay. And happy to provide feedback regarding what your thoughts are.
All right. Thanks, David. All right. So the next topic is the one question survey that I sent you guys. I'm sorry for kind of hounding you about that, but I really wanted to get your feedback before we just made a decision one way or the other, just with the program. Um, you know, leadership change and just the way that things have kind of been going, we wanted to make sure that we were being responsive to what you wanted. And so um, the survey showed that 5 people, I only had 8 responses. There are 9 of you. 5 people wanted fully virtual capstone presentation day, and 3 voted for the in-person. So I think the next steps would be for David and I to put our heads together and see what that would look like for all of you. We want it to still be a special day and the culmination of your program. And so, David, do you have other thoughts
Yeah,
on
I
that?
would like to hear like your thoughts on this. This
Mhm.
is based off the survey results, but um, I mean, the capstone presentation day, whether it's in person or on virtual, doesn't mean that that has to preclude doing anything in person too.
Oh,
So we would like your perspectives on these things too. Like provide us your feedback. We want to do what is in the best interest of all of you too. We know that travel and getting on campus for like 2 full days, sometimes that can pose some challenges. So we want to do what makes the most sense.
um, yeah. So feel free to email us, but I think with your specific thoughts and ideas on that, I'm open to anything. Laura, did you have something you wanted to share?
Well, what one of the other programs that I support, the Applied Data Analytics, there's been times where they've had to do a hybrid. So if somebody cannot attend the on-campus
Mm,
portion, that they have the option of doing it virtually. So maybe having something both ways, a hybrid model for those who can't. Summer is a very busy time, and that's when you're completing the program.
mhm.
And I also wanted to ask were the cohort one presentations recorded?
I
No,
don't
we
think
did not record them, Laura.
Okay. But feel free to reach out to the cohort one, and if you want some connections, I can, connect you with them too to get, they'll give
I
you some great feedback and, hearing what they have to say might be helpful. Um,
I think that's another thing is if it's virtual, it's a matter of how formatting. And
Right.
so to sit if it's 30-minute presentations, then that's an extended time to be online. We'd probably want to spread that across more than one
Right.
day too.
Right.
I'll tell you what we do in the health informatics program is we have like a website that we have where we record the sessions, and anyone is invited to those virtual
Mhm.
capstone. It's the health informatics students do a very research based project, okay, and they're recorded and then made. Anyone can attend the in person, or I'm sorry, they're not in person. The virtual synchronous sessions for the presentations, and then the recordings are kept in perpetuity. So there's a index of all the work that students have done going to the beginning of the program. I would say this at this point, if you've got opinions, perspectives, just share them, with Katie
Yeah. Yeah.
predominantly, and we're happy to, do what's in the best interest. It looks like majority want to do a virtual capstone. I can
Mhm.
understand the in-person connection is important too.
Mhm. Right. I think that was all I had for tonight. I think the last thing is just if there's any programmatic type questions or anything you guys are concerned about or have questions about, David and I and Laura we're here to answer
Mhm.
those. So,
I think we'll soon have a full MHA like town hall. Katie and I are like in the midst of CAMI accreditation stuff. Katie is doing awesome work. That by March 1, we're submitting our application for candidacy for CAMI accreditation, which is Awesome. So that's our deadline, and we're making really, really good progress. We're meeting with Cami on a weekly basis, and yeah, things are going very well. So more to say about that, but with Katie, it's like yeah,
Yeah.
it's a lot of work. Aaron, I'm assuming the capstone presentation will be in a PowerPoint format. I would say PowerPoint or Google Slides would be, yes, that would be the format. And then you'll also have your paper that, you'll build that presentation based off of the paper. And we'll have some formatting, requirements for that presentation.
Yeah. The one thing I did want to, that I, one of the things that I felt after attending the cohort one was that it would be nice to have everybody doing the same type of presentation versus like a poster. So I definitely would like to lean towards that, whether it's PowerPoint or slides or whatever, but probably no posters. So
Yeah.
um just gonna
I
look and
just
see.
want to say that you are in
Sure.
great hands with Katie and David. They are amazing. And there's so many other resources out there. We have a distance education librarian if you haven't used her for any of our projects for doing
Oh yeah.
Yeah.
research, our writing center. I mean, there's just tons and tons
You
that
know,
we're here to support you on.
That is, Laura, I'm glad you mentioned that. That's
Yes.
something we will schedule is like week one is
Mhm.
we'll schedule with the librarian. The library often for graduate students is an underutilized resource
Mhm.
that they can really, really help you in that literature review process. So
And I think even in one of the units, David, it's even built in that you need to
yeah,
reach out to Julie. So,
yeah, that's
yep,
great.
yep. So, any other questions before we take off here? All right. Well, David and I are definitely here to bounce ideas off of and to meet with you. And so if you have any questions after you take a look at this, I'll get the recording downloaded tonight and posted. I'll email it to all of you right away so that you can dive in and get started. So um, yeah,
All right. Yeah, thank you,
thank you
everyone.
all so much for being here.
Have a nice week. Thanks.
Yep.
Take care.
Bye.
Bye.
Yeah.